Well, I think, in the early days of going, we were blessed to be able to be fully integrated with the University of Maryland medical system. That gave us not only evidence-based best practice about how to care for these patients, but also access to the necessary supplies. Particularly early on, personal PPE, personal protective equipment, was hard to get. You'll surely know that we were challenged with the supplies of that, but also as we learned more and more about the disease, how to care for these patients changed as well. So we were seeing many, many more patients very, very acutely ill early on. We peaked sometime around in April or May. But I never felt that we were ill-prepared. We were always preparing. We continue to prepare. We keep very, very close watch on the number of patients that are cared for within the hospital. We're very cognizant of how many patients are hospitalized across the University of Maryland medical system, but also keep in close contact with our communities to make sure that we have a sense of what's going on, whether it be in, if you will, the poultry industry or nursing homes, to make sure that we are using all the elements of that team to make sure that we minimize the impact of the disease on the communities we care for. The challenges with supplies have in many ways focused in on rapid testing materials now at this point, but we've improved access to routine testing for asymptomatic patients, stood up a community-based testing site at the college in collaboration with Chesapeake College, the University of Maryland medical system, where people, they aren't necessarily patients, can go and get free testing, and we continue to offer that on Mondays and Wednesdays. We've done that in collaboration, of course, with the county health departments that are doing the same thing. So I believe we've well prepared ourselves for the next surge, which has the potential, again, with the impact of the flu, to being potentially very, very dangerous to our populations that we serve. There is a grave concern that if we don't continue to do social distancing, mask wearing, and washing our hands, that we'll see a further increase in the number of cases, both in our communities, but also in the number of patients who require hospitalization. It's going to be a very, very difficult situation when the holidays come and there's going to be the desire, as all families do, to come together. And there needs to be serious consideration about how to manage that. It is best to remain socially distant. It is best to wear a mask and wash your hands, but it's also best to stay away from crowds at this point as much as possible. And the influx of people, family members coming from across the country, obviously suggests that there will be exposures that has the potential to spread the disease. And of course, that's what we want to minimize. Everyone who participates in healthcare has done a phenomenal job of stepping up and addressing this pandemic. I think that there have been a lot of stressors placed on our teams and our patients, and we've done a good job trying to address those stressors. I think right now, because of the relatively lull in the number of patients that we have right now, that perhaps some are getting a bit of a respite from the very difficult times that we've experienced in the past. But we have to, again, continue to prepare for what could be another surge coming in the late fall. We did essentially delay any elective surgeries. We've now luckily have returned, and we've decanted and can say comfortably that all surgeries that need to be done, elective and otherwise, are being done. It does take us a little bit longer, mostly because we have to follow processes that are associated with the pandemic still being present in our community. That means preoperative testing. That means doing certain things depending on the procedure that go above and beyond things that were done before the pandemic. I'm hoping for the vaccine to come as soon as possible. I don't know exactly the timing on that, but at this point, we need to prepare to care for more patients who may become ill with the COVID resurgence, the surge, and or the impact of the flu that is likely to have some impact on. The way forward is, again, and I'll say it again, the three things that need to be done are to continue to be vigilant. Mask wearing, social distancing, washing our hands, being prepared for the worst, hoping for the best, constant vigilance in terms of attention to caring for each other, for our loved ones, and for our team members, and our public safety providers, to make sure that we have those teams available to care should we need to with the upcoming surge.